Welcome back. This is part 3 of my discussion with Dr. Jessica Bishop-Funk, who is the Awake Dentist. And Jessica, we had a little bit of a email conversation after part 2, and there were some things that you wanted to get off your chest or clarify about root canals. So go for it. What do we need to know?
Well, so an observation that I have had over 25 years of doing this is that patients who have a posterior root canal often tend to have more than one. And I've inquired with my endodontist, the one I refer to predominantly, as to noticing this trend and wondering if there was some biology or pathology behind, what might make a person more prone to needing root canals. And he had no response for me. So I think there's a bigger system at play. And one of the interesting things that I noticed during COVID, actually after the shots were rolled out, was that I saw a demand or a need for root canals on a level that I had never seen before. So teeth that may have been previously treated and asymptomatic, all of a sudden there were more retreatments being done, or teeth that were fine, and all of a sudden, I was referring out a lot more root canals than I remember doing before.
I want to back up a step here. So the reason for getting a root canal done is that correct me if I'm wrong on any of this, just jump in at any point if I'm going off the rails. So the reason a root canal is done is if there is a cavity that... is it always the case where there's a cavity that's been previously filled, but no, okay, you take it away because I'm clearly going the wrong direction.
I would say that that's the predominant indication, is that there either is a history of a deep cavity, or that was restored, and then the trauma of that procedure or just the cavity experience in general caused the nerve to die over time, and then at some point in time there's an imbalance in the immune system is something I'm suspicious of, that the body was able to handle the trauma and kept everything at bay, and then there's some weakening in the immune system that then causes that tooth to become abscessed, where the patient has pain, or there's some inflammation in the mouth, as far as having some type of pimple on the gum tissue indicating infection.
Yep.
And then a second reason, and this is another interesting, is a history of trauma absent a cavity. So you're hit in the face by a ball as a child, you fall and hit your front teeth, but then for some reason when you're 35, something that happened when you were 8, now abscesses. So getting back to my comment about the COVID shots, and I have not really talked to another dentist about this, but so my impression of all that I had read on the COVID shots as far as decreasing, kind of telling your immune system to stand down, had some impact in the oral cavity on these teeth that may have been kept in balance in some fashion. And all of a sudden now there was a much increased need for root canals than I had seen in my history of referring patients for root canals.
Yeah. That is super interesting. So is what you're talking about the IgG4 class of antibodies that particularly picked up in people who had boosters? So I don't think that IgG4 class, which is immunosuppressive, or that's not the right way of putting it. So the IgG4 class basically induces tolerance for an antigen. And my understanding of that is that it was the third shot where this particular class of antibodies really started to go up. Does that jibe with your observation, or was it earlier on in the piece when people had?
It was earlier on. So I was thinking it was more. Because I want to say I started noticing this kind of late spring, summer of 21. And then it really started going in 22. Now the boosters were out in 22, so I may not have a direct correlation there that
Yeah. Well, what about masks? I did hear a lot of dentists say that they were seeing really accelerated rates of decay in people who were wearing a facial decoration all day. Did you?
I can't say that I observed that at all. I
Okay.
mean, I can understand
Interesting.
the logic behind it, but I can't say that I
You didn't
observed it.
see it. Okay.
And
Gotcha.
perhaps,
Gotcha.
and I would say it's probably because the patients I serve are what they call the laptop class. So they are able to work from home. Their kids were home, on the computer. So I
So
don't.
they would have worn their mask when they went to the grocery store, but
Yeah,
not all day, unless they were
right.
doing that performative, ridiculous thing where they put it on for their Zoom meeting, which I
Yes.
did see a few people doing. Like, call the psychiatrist, you need help. Yeah, actually, you won't get help from a psychiatrist. That's a whole other podcast.
Yeah.
The thought just occurred to me: would the microclotting, the microthromboses that we're seeing, the jabs and tubes, would that have anything to do? I mean, if you've got microclots, you're not getting the oxygen supply to tissues. You're talking like tiny, tiny, tiny blood vessels that are supplying blood and oxygen, nutrients to teeth. Yeah.
I think that's an extremely rational hypothesis. I was thinking more about the methylpseudouridine and how it. My understanding was it kind of tells your immune system to stand down.
You're right. You're right. I have heard the wonderful Dr. Jessica Rose talking about that. Okay,
yes.
So we've got the methylpseudouridine, we've got the IgG4 class antibodies, we've got
And
microclots. It's a big disaster.
Yeah. So
yeah.
So that observation was something that I had made during COVID, but historically I have noted that patients with posterior, and the reason why I'm singling out posterior or back teeth root canals is that usually those root canals are due to decay because there had been a prior filling. Mm-hmm. The root canals in the anterior are usually due to a history of trauma. I mean, typically, not across the board, but the front teeth, if you take a blow to the face, your front teeth are the ones that take it. And then the years down the road, the indication can often become necessary to have a root canal done.
So interesting. Okay.
Yeah. And then, and I don't know, again, I don't know that this is well studied in my profession. It's just observations that I've made that I've been curious about. And teeth that I had during COVID, I had some teeth that were sort of questionable. We've kind of been watching them, minding them, if you will, because they weren't symptomatic.
Yep.
And all of a sudden, during COVID, teeth that I've been watching for 10, 15, 20 years were either being extracted or being retreated. So there's something in the immune system that was triggering this, in my opinion.
Yes. And you were aware of the COVID jab status of your patients? Was that something that you asked? Yeah.
I never inquired, but I didn't have to because they would come in broadcasting.
Yeah, right.
I live in a town where
I'm up to my 15th booster. Yay me.
Yes.
Oh God.
Yes.
Yeah. Right.
And so that was just something I wanted to make sure that I had a chance to share, because I think it kind of ties in. I struggle with this part from the viewpoint on the holistic side of dentistry being a hard stop, no root canal ever.
Yeah, there is a camp among holistic dentists who are just dead against it. And as we discussed previously, well, the problem if you don't do root canals, it's like, what's your alternative?
Thank you.
A bridge, an implant. Those have problems too, or just like have the tooth removed and then other teeth are going to move into that. Yeah, so there are no kind of fairy tale ending solutions to this, are there?
Correct. And I have a thought I was going to share with you, because in your world you may be able to have 2 cents, but I've seen, and I think I saw it on the questions asked by your readers, was some connection between breast cancer and root canals. And so coming back to my earlier comment about seeing some patients just seem to need more root canals than the next patient who has a cavity equally as deep, just as traumatic, and nothing bad happens. So is there potentially not so much that the root canal is the cause of the breast cancer, but there's something in that patient's immune system that isn't functioning 100%?
That is a very astute observation. In other words, you're saying there's confounding here.
Yeah.
there's a third hidden
There's
factor. It's
there's
not
very
it's not cause and effect. It's not you had a root canal that caused your breast cancer. It's you have something a bit skew-if about your
yes,
immune system, about the balance between the inflammatory activity of the immune system and the sort of pathogen controlling activity of the immune system, and that imbalance makes you both prone to the kinds of issues that result in a root canal and developing, for example, breast cancer.
you nailed it.
Yeah.
So, and this is
Mm.
where I had a thought as far as those patients who are, listening to this and now questioning what to do. And my opinion would be, if, because I think somebody needed a root canal and they were going to go have the tooth extracted, in the
Mm.
comment section, would be to entertain the idea of having a root canal. Absolutely have it done by a specialist, which I assume you have in Australia.
Yes.
You do not, you want to see a specialist, and nothing bad to dentists, general dentists who do them. I'm sure they do a great job. But somebody who does a root canal all day, every day, is going to do it with a level of precision. If you do 100 root canals a month versus, 10 in 3 months, who's going to be better? The person doing
It's
it all the
it's
time.
the same with any kind of surgery,
Right.
isn't it? Do you want to have your, well, not that I'm in favour of knee replacements, but you want to have a knee replacement done by a guy or gal who does this all day, every
Right.
day,
Every day.
who's seen every shape and size of person and every different configuration of knees, or do you want it done by the dude who kind of does this part-time
Exactly.
in between all sorts of other surgeries? Yeah.
So I didn't know, and this is where you can answer. So my thought for patients in this sort of conundrum of making a decision would be: are there biological markers that could be evaluated post endodontic treatment after there's been sufficient time for the body to heal? Which I would say, 3 to 6 months for recovery from the procedure, to have something to evaluate, to say, there's something else going on in the body still. Maybe it's this root canal causing certain blood cell counts to be off. I don't know. I don't know enough about
There,
that side.
there are actually some labs, most of them US based, that it can do extremely advanced, you might say, profiles of immune and inflammatory activity. So I don't know of any that sort of specifically market this around dentistry, but that would be a really interesting thing to look into. So I shall put that on my to-do list, because these tend to be quite expensive, but
Um,
for a person who is interested in this and concerned about the implications of a root canal for their health, could be worth spending the money.
yeah.
Mm.
And saving a tooth and having, and I would say, if you're asymptomatic, if the root canal is done and radiographically the periodontal ligament is still intact and you have no symptoms, I don't even know if that testing would be necessary, but having that as an option,
Yeah.
to rule out, it's just a thought I had.
Yep. Wonderful. Wonderful. On the sorry, was there anything else you wanted to say about root canals? Or?
I think that's the main gist.
Excellent. All right, so we can tick that box. Someone made a comment about bone used in dental implants, and sorry, let me just get the exact text of this. Where was it now? During the implant process, crushed bones from a recent dead person they later correct this to, is compacted where the previous tooth was. If those bones come from a dead person who has been jabbed, can you get the spike disease? Blood transfusions with spike blood has resulted in spike disease, so do crushed bones do the same? Now, this was news to me. Is it true that crushed bone from a recently departed personage is rammed into that space?
There are 3 types of bone grafts that can be done. You can have it from cadaver bone. Yeah. As far as the recency of that person's passing, I claim no knowledge there. I do know that the bone is sterilized. Mm-hmm. So in a process that I would assume render the spike protein, if the spike even accumulates in the bone, I'm not familiar with. I don't know.
Yeah, there doesn't seem to be a plausible mechanism for spike accumulation within bone, right?
So I wouldn't be too worried about that, because your other 2 options for bone grafting would be bovine, would be from an animal,
Yeah.
or your analog, where you have it from yourself, an auto.
Oh, an autologous, right? So you've actually
Mhm.
got to get some bone
Yeah, they can take
out.
it from your chin or from your mandible. Yeah,
Oh,
or your hip.
okay. That sounds like it
Mm.
could be complicated.
I don't think it's done very frequently. I think the bovine and the cadaver bone are used most frequently based on
Yeah.
my patient selections.
Gotcha. All
Yeah.
right. Okay, I
So for
think
that,
we can tick that one off. There was a couple of questions actually about safe removal of amalgam fillings. So should we do
yeah.
a quick overview of that? I mean, that's a complex topic, I know.
Yeah, I would like to talk about that because that's another area within the holistic field that I don't know that I completely align. I
Mm.
listen to, I don't think that having mercury in your mouth is safe. I'm not saying that. And I'm not saying it's fantastically safe to have it removed either.
Mm.
The graph that I saw when I was doing some continuing education on from a holistic side on doing safe mercury removal highlighted the fact that when you use the high volume evacuation, which is the large suction that we use, the amount of mercury vapor measured versus without it and with it almost removed it completely.
Mm.
And that's not to say that there isn't still a little bit,
Mm.
but that high volume evacuation has a very powerful suction that's able to pull the debris from the patient's
Yep.
mouth. And then the patient can
So
be
a
done.
lot less for them to inhale or aspirate.
Right,
Yeah.
right. So,
Yeah.
and I know that I guess where I struggle with what the holistic side is recommending is, you're coming into the room looking like you're going to the moon, the doctor, the
Mm.
assistant, and then the patient is draped so significantly with this high volume, like even you have the high volume suction going, but then you have another suction, almost like a big vacuum cleaner in front of the mouth, and then they have auxiliary oxygen to breathe over their nose, and everything is covered except for the mouth, which is then isolated through a rubber dam.
Yeah.
And I have so many patients that have claustrophobia and issues
Oh, that
and
would be such a
anxiety.
nightmare having all of that
Oh, and I
gear.
cannot imagine walking into the room and
Mm.
having people be okay with that. So
Yeah.
for your listeners, I would say, you know, I'm sure you have detox mechanisms or methods that you could recommend to a patient after they've had a silver filling replaced or
Mm.
taken out. And
Yeah.
then I would say, just your doctor is definitely going to use the high volume evacuation. He or she, I know that that's like breathing in dentistry is having that thing running.
Mm. Mm.
Um,
Yes, sure. Yep, yep,
you
yep.
could also request the rubber dam, which is an isolation method for the tooth where a little ring goes around the tooth and then a piece of rubber covers the face.
Yes.
And I think that is sufficient to protect you and then have your detox. But something that never is touched on, and I wish that this would be brought up, if the mercury toxicity from breathing that vapor is so dangerous, why are we as dentists not just afflicted with all the neurological diseases that are then potentially attributed
I
to it?
have heard the suicide rate among dentists is higher,
Yes.
among the highest of any profession, but maybe that's not just mercury.
Yeah. I mean, there are other reasons. You tend to be a bit anal retentive if you're a dentist and you work in small places where people complain that they hate to see you. So that's a
That.
multifactorial. Yeah. So
Yes, yes, yes. There could be like a lack of job satisfaction for those reasons. Has there been research on the incidence of neurological disorders among dentists? I mean, is there a higher rate of these? Has anyone actually done this?
I don't know. I'd have to investigate. I'm just saying anecdotally,
Yep.
I know a
You
lot of
don't you
older.
don't know a bunch of dentists who've been
Yes.
afflicted by
Or
neurological disorders
hygienists
related to mercury.
or assistants. There's females that work alongside their dentist,
And those
who,
females also get pregnant, they bear
yep,
babies, so you'd expect there to be some sort of epidemiological study done.
something. Yeah.
That
So,
you'd hope that'd be something that dental associations might sponsor, but
yeah.
maybe there's a
Mm,
conflict of interest there.
yeah, exactly. Huge. So I guess my summary of that would be, if you're all for going to see somebody who's going to take it out in the safe mercury removal where everybody's draped,
Yeah.
have at it. I'm sure the cost is astronomical compared to going to your regular dentist, but your regular dentist under high volume evacuation and a rubber dam, seek out some type of detox after. you're going to be fine.
Yeah. Okay. Good
That's
to
my
know. Good to know,
mistake.
especially for people who are struggling financially.
Yes.
After all the COVID debacle and want to get their teeth fixed and don't have a pile of money to blow on it.
Yes.
Okay. Good to know. Good to know. We had a couple of questions about teeth whitening. What causes tooth discoloration in the first place? Are there any safe whitening methods? What would you recommend?
Tooth color discoloration it can be intrinsic. It can be just something that as you age, as your enamel thins, you see more of the dentin underneath the teeth just naturally get a little bit yellower.
Mm.
But
Mm.
things in our diet will also stain our teeth: coffee, wine, blueberries,
Polyphenols, basically.
yeah,
Yeah.
yes. And so those stains are very effectively removed using hydrogen peroxide or carbamide peroxide based gel. Now, as far as, and this is not a dive I've made, as far as what else is in that gel that could be toxic that we're concerned with.
And what effect does that hydrogen peroxide have on the oral microbiome?
Yeah, so if you're doing it in a tray where it's isolated, because I highly recommend that you have it done professionally where you have a custom fit. So when that gel goes into your mouth, it is only on your tooth structure, nowhere else. And then as soon as you take it out, you're brushing it off. Now I know sort of an old-fashioned way of taking care of the mouth was rinsing with hydrogen peroxide and things. Some people even brushed with it. As far as those implications, I don't, as far as it's not going to whiten your teeth doing that. Not enough contact time in my opinion.
Yeah. So it's got to be direct contact with the teeth for an extended period of time, for example, overnight.
I tell patients, I don't know if you had these commercials in Australia, but it's like a Tide commercial. You're washing your laundry, you have a stain on your white t-shirt. You don't put it on there for 10 seconds and expect the stain to be gone. You let it sit.
Or in my case, living in a part of Queensland that has really red soil, that stain ain't coming out. Never buy white again. Alrighty, so teeth white. That kind of we touched on this previously, just in regards to toothpaste. Do you recommend the toothpaste that have, for example, hydroxyapatite? And I know we had a bit of a to and fro about nano hydroxyapatite. So bring me up to speed, because I know you started looking into the nano hydroxyapatite after our exchange. Yeah. Well, what did you find?
So I do want to reach out to the company that is marketing the product that I like so much, who is using the nano hydroxyapatite, because after you kind of brought my attention to that, anything I research nano is not positive. It's just we don't know. And the argument that I would say for toothpaste is you are spitting it out. What's absorbed sublingually, which is my issue with fluoride in toothpaste, what I can't speak to. So I was going to reach out to the company and inquire with them as to why they specifically are using nano, and if they would ever consider, because I'm thinking in this space, people who are going for a fluoride-free toothpaste are people awake to what's going on generally. And they're also going to become awake to the concerns over nanotechnology, because it's everywhere.
Do you want to just very briefly outline the concerns about nanotechnology generally? Because there's also an issue about possible nanotech in dental anesthesia.
Yeah, I wanted to get to that too.
Oh, okay. All right. So do you want to do a brief overview of what's the deal with nanotechnology?
Well, I am not even going to pretend to claim to be any level of expert on this. It's just using these super tiny particles to be able to get into places that we were otherwise previously, unreachable. And my understanding is it's crossing barriers that it should not be crossing, like the blood-brain barrier. And things are being found places where we didn't want them to be found, specifically as they looked at the lipid nanoparticle, right, from
for the COVID shots. Yeah, the lipid nanoparticle that was specifically developed to deliver chemotherapy across the blood-brain barrier to get it into brain tumors. Yeah, but hey, if you wrap it around spike protein, it'll just stay in your shoulder. Right? That's plausible.
But going back, thinking about dental school, we were the composite, the plastic fillings that we place, which I've already told you how I have some reservation about that because it's plastic. They're filled with nanoparticles. and that's been going on for I mean, I've been out of dental school 25 years, and we were talking about that in the late 90s. And it was like, an awesome revelation for dentistry to have these nano-sized particles in the composite, because it made it for a better composite restoration.
Yeah. Okay.
So there's a lot to learn. And as far as it relates to toothpaste, I'm still trying to find something that contains hydroxyapatite that has the same fabulous clean feeling that the one that I have been using does. The one with the nanohydroxyapatite is just an amazing clean feeling in your mouth.
Gotcha. Okay. But you have these residual concerns about the
absolutely,
version of hydroxyapatite. Gotcha. And while we're on the subject of nanotech, then the nanotech in dental anesthesia. Do you want to just briefly?
I do, but can we go back to the toothpaste for a second?
Oh yeah.
Because and I'm sure a lot of your listeners would be aware of this, but the other ingredient that you don't want in your toothpaste is sodium lauryl sulfate, which is that has no purpose being in your toothpaste. It's a cell membrane disturber, and you can, I believe it's pretty pervasive within the dental tubed toothpastes.
Yeah.
And a lot of the more holistic ones are not going to have that in there, but you want to stay away from sodium lauryl sulfate.
Yes. So that's also implicated in the formation of ulcers, of mouth ulcers.
Yep. So, and as far as the anesthetic, so I would say, a year or so after the shots came out, I started seeing rumblings, specifically the brand Septicane dental anesthetic, having, I don't know how to say her last name. There's a doctor who's put out a video using dark field
Dr. Anna we're both going to stumble, aren't we?
Call her Dr. Anna.
I think it's is it like Mihalcea? I think
something like that. It's almost like Michaela, but minus a C in front of the H to make it look like that. But so we'll call her Dr. Anna.
We'll call it.
So Dr. Anna has put out this dark field microscopy of the Septicane brand, manufactured by Septodont anesthetic, having the nanoparticles in it. And it's I think she has several articles that she's written with the video and photos of this imaging. So I kind of just brushed it off. I couldn't go there. I'm like, no, this can't be happening in dentistry too. And then it just keeps reappearing. It reappeared on your Substack, and then I posted somewhere this weekend trying to bring attention to the fluoride debacle. And then as soon as people knew I was a dentist, I got bombarded with that question all over again. So people know. So I have a good friend who's a trained practicing pharmacist, and also a trained oral surgeon, practicing surgeon. So brilliant. This man is brilliant. And he's also a very good detective. So he got the material information sheet from Septodont on Septicane, and there's nothing indicated on the safety sheet, the material data safety sheet, that this contains nanotechnology. So he emailed the company, referencing the data sheet, and the company denied right away that was being done in their anesthetic. So he then followed up with them with Dr. Anna's writings, as well as her videos of the dark field microscopy. And we had a response saying, we will look into this, with no follow-up since. And so he's also followed up with Dr. Anna saying, hey, we've contacted Septodont. They deny this. You having fraudulent information out there about them potentially is a risk to her if she's lying about the product.
They could sue her. Yeah.
Correct. But the one thing we learned in the process of this is they manufacture it. They don't manufacture it themselves.
Okay.
Septicane. So somewhere else it's put together for whatever that's worth. I don't know if that means that there can be shenanigans because it's a third party making it. That I can't speak to. So we're working on it, and he's considering buying a dark field microscope so that we can investigate it, because it's an anesthetic that we can easily come by. But Why
Yeah,
is that?
sure. There's
And
a
why is that the only one? Like, why is that the only one implicated? Why don't the others? The more common one used is lidocaine.
yes.
And so anyway, we're working on that.
Okay, good to know. All right, keep me updated on that. Excellent, excellent. Just before we leave the toothpaste subject, I'm just looking down my list of questions. I did just want to mention something very briefly, which is we discussed nitric oxide production in the mouth, and how basically the oral microbiome plays a huge role in converting dietary nitrates into nitric oxide, which is a vasodilator. It has anti-infective properties. It stops the adherence of atherosclerotic plaque to artery walls. Pretty good stuff. And one thing that was actually that I learned some time ago is that fluoride actually kills off the bacteria that form nitric oxide. So it's not just the antiseptic mouthwashes that are a real problem in terms of nitric oxide formation in the mouth. It's actually the fluoride in toothpaste. So anyway, that's nasty stuff. So I do hope you get some good news or some update from the company that makes the dentifrice that you were talking about before.
Yes, yeah, and I will keep you posted on that because it's a good one.
Yep. Okay, someone had a question around the bolus effect, and does that apply to injections used in dentistry? So, I think you've probably heard of Marc Girardeau and his bolus theory in relation to the COVID injections.
Mm-hmm. Okay.
So just for our listeners, Marc Girardeau has proposed that he's quite adamant that this is the major mechanism of damage with the COVID injections. And anyway, that's his opinion. So the bolus effect is basically if you inject the substance, in this case the COVID injections, all in one go. So specifically, not stopping to aspirate to make sure that you're not that you're achieving an intramuscular injection rather than an intravenous injection, and then just like shoving the whole bolus, the whole blob of the injection in one go. And so Girardeau says that bolus, because you've got a large amount of this substance all in one big blob, the chances of it sort of going into an artery, say in the heart, for instance, and then causing sorry, I'm going to truncate this discussion, but causing massive damage in the sort of in the finite area that a large amount of it is coming in contact with. So he says that's the major reason why we're seeing this high rate of cardiac events, post injection. So with that as background, does that bolus effect apply to dental anesthesia? I mean, we're talking about totally different things that are being injected into the body, but is there a possibility for a bolus effect?
Well, sure. I mean, if you get into a vessel, especially with the epinephrine, it can, cause the heart to race. So we are trained to aspirate. And that I know that I hadn't heard of that doctor before, but I had heard that mechanism as a potential, one being laid out there as far as why we were seeing certain things, as far as I think, if I heard this correctly, I believe they were told not to aspirate.
They were.
When they were. Which is, I don't think that's...
So that they could inject faster and supposedly with less pain. Yeah.
Yes, yes. But I was going to say, I don't think that's typically how they're directed or taught to inject.
The opposite.
I said, that's not how we're directed. I mean, we're taught to aspirate.
Yep.
So as far as your dentist, I don't know why your dentist wouldn't aspirate and make sure that they're not. And as far as the risk, you're correct. You're totally two different substances.
Yes.
And the main issue with the anesthetic would be the epinephrine causing, some heart racing if, it's injected into a vessel.
Excellent. Okay. But if it's delivered in the location where it's supposed to be, which is what aspiration is intended to check for, then you're not going to have this bolus effect. Okay.
Correct.
Good. Excellent. We had a question, and sorry, I mean this kind of strictly speaking is outside your domain as a dentist, but I wondered if you had any thoughts on it. So one of my readers asked, is he kind of like wasting his time if he installs a water filter with a fluoride removal cartridge for his drinking water, but then he goes and takes a shower and is actually bathing in fluoridated water?
Yeah.
In other words,
That's a smart man. Oh, let me turn off those notes. That is a smart man, because as I was researching this, one of the things that was brought up was the fact that our so much is absorbed through our skin. So when we're showering, we may only drink the 1 liter per day that they're telling us to drink and have that 0.7 parts per million, which is what the United States does. But as you bathe, and back at one point in time in history, for patients who had hyperthyroidism, I think it was hyperthyroidism. Yes, pretty sure. They would bathe in fluoridated water to affect the thyroid, to bring the thyroid activity down.
Yeah,
So
gosh,
I would say to him and anybody,
they're both halogens, and fluoride competes with iodine for uptake, or fluorine. Yeah. Oh boy, that's so interesting. So there is actually absorption of fluoride compounds through the skin.
oh yeah.
Yeah, so you want to get a whole house filter. Or I live in an area where there's no town
right.
water. We have tank water. Although to give credit to my local council, my council, we discussed this last time we spoke. My council is or was it the first time? Anyway, we discussed this previously. My council is one of the quite large number of local councils in the state of Queensland that it's not added fluoride to the drinking water. So even if I wasn't on tank water, I'd be cool in terms of fluoride. I happen to actually know this person. We met up. Anyway, that's kind of outside the scope of our discussion today. And I happen to know that he's actually bought some land in an area that I'm fairly sure the council does not add fluoride, so his problems could be solved. Good. In the meantime, you can buy a whole house filter. They are more expensive, though.
Yeah, they're very expensive. I don't know what they are in your country, but we looked at them here, and I think it's about a $6,000 or $7,000 investment.
Yep. That's what I've seen here. Yep.
Yeah, for a 4-person family.
Yep.
How closely are you all following what's happening in America with this lawsuit that's starting next week?
There's, as you can imagine, there's been absolutely no publicity of this case in the mainstream media, but yeah, I've been following it pretty closely.
Yeah, it's pretty interesting, and be curious as to what resolution there is on this topic.
Yes, I think if the case goes as I think it should, in view of the science, it's going to be very interesting, because we discussed previously how state authorities in my state of Queensland are essentially trying to override the control that the local government, which is the councils, have on whether fluoride is added to the drinking water or not. And of course, they are saying that the dental benefits of fluoridating the water are completely proven, which clearly,
even if they're proven, is the risk worth it? And if the risk,
that's a really good point. But I love, and I'm going to include the chart that you had in your Substack on that basically shows the decline in rates of decayed, missing, and filled teeth. Right. In countries that do fluoridate versus those that don't. And when you have a look at this graph, you'll see that the countries that have not added fluoride to their water supply have had as great a rate of decline in decayed, missing, and filled teeth. In some cases, a greater rate of decline than the countries that actually added fluoride. So that's pretty interesting. But yes, even if there were these dental benefits, even if that were the case, the trade-off for reduced IQ in children, which of course results in lowered IQ throughout the entirety of
lifetime, right?
Yeah, and that also results in decreased productivity. I mean, if you're dumber, you can't do as much intelligent work. Okay, correct. So your lifetime earning capacity is reduced, and your value to the state, I hate putting in those terms, but hey, if you're in government, that's how you think. Your value to the state is reduced because you're basically just dumber. Sadly. Yeah, so this case in the US is going to provide a lot of ammunition for groups in Australia that are basically trying to rein the state government in to say, back off. The councils express the will of the people in not adding fluoride to the water supply, and you're not going to override that. Anyway, fingers crossed.
Yeah, and I think it's such a, if you look at the totality of the situation between fluoride and the COVID shots, and to me, fluoride is a forced medical treatment because you don't have the option to not drink water.
Uh-huh.
and you
Or
have,
bathe
yes,
in it. Yeah.
right, right. So you're being forced to accept a medical treatment that comes with risks for
Mm.
some, maybe all. But yes, it may benefit your teeth, and that's just not fair. And so I think more after people have been forced to take a shot they didn't want to take, or they stood their ground and didn't take it and sacrificed as a result, are going to be more open to the fact where they might have overlooked the fluoride in the water before.
Oh, without a doubt, without a doubt.
Yeah,
And you said previously that fluoride is to dentistry what vaccination is to medicine. And
absolutely.
if you look at them as two public health interventions, and I actually don't know about the timing of the introduction of fluoride into the water supply, as you rightly point out, this is forced mass medication. If I'm right, that actually
Oh,
preceded the
yes.
mandating of vaccines, except for smallpox. So there
Yeah,
were
just by a
smallpox
little bit. I mean,
vaccine
they
mandates.
very similar time frames within almost a decade of one another.
Okay, so interesting. Yeah. So you could say that actually introducing fluoride into the water supply was almost like a Trojan horse. If they get away with this, if they get away with
Um,
forced, no informed consent, mandatory mass medication of the population,
yeah,
what the lessons learned from that could be translated to forced, mandatory mass medication of the
yeah.
people with vaccines. Mm. That's
Heavy.
something to ponder, isn't it? Okay.
Mhm. Yeah.
All right. So we've talked about absorption of fluoride through the skin. Periodontists. There was
Mhm.
a reader who expressed some skepticism about the profession of periodontists and wondered, like, is this just a scam? Is this a money-making thing? Can I just go see a dental hygienist? What's the value or otherwise of seeing a periodontist?
Oh, I'm afraid to answer.
Well, this might
So,
get you in trouble.
well, I actually was emailing with another dentist today. He's a retired oral surgeon, and and he's like-minded on the COVID shots and some other things in our field, especially fluoride. And I was asking his opinion on the root canal situation because I feel, maybe I've already said this in our conversation, but I sort of feel professionally homeless. I don't belong in the mainstream dentist. I'm much more on the holistic side, but I don't agree with everything, and I don't know if they're open for discussion. So as far as it comes to periodontics, it is my least favorite, my absolute least favorite subspecialty of dentistry,
Mhm.
and I can probably count on one hand. I can probably count on two fingers, maybe one finger, the number of patients I refer a year to a periodontist.
Whoa.
Yeah,
Okay.
so I have some very strong opinions here.
Clearly.
Yeah. I do, and not to say that they're not they place implants. And so for patients who need implants, I know they do a really good job. They're extremely meticulous.
Yeah.
But the thing that I really struggle with is the grafting for recession. So when that sort of I want to say sort of
Oh,
the
okay.
bread and butter, obviously you have the scaling and root planing,
Yeah.
and that sometimes is necessary. I think it's way overdone. I feel, at least what I've seen a lot of, I would call it fraud, where patients who do not have radiographic indication for need of scaling and root planing are sold scaling and root planing, which is the
Okay.
deep cleaning under dental anesthetic. But as far
Right.
as the bread and butter in that field, and this is my opinion, I want to make sure I say this, is that what I have seen with tissue grafting, they take tissue typically from the roof of the mouth to restore areas where there's been loss of tissue.
Mm.
It's that predominantly those cases over the long term go back to looking just the way they did before the
Okay.
procedure was
So they
done.
undergo a process that is, I'm guessing, very expensive, painful.
Painful,
Painful. Yep.
extremely painful.
Okay.
Yes, the
So
recovery.
costly, painful. Are there complications? Is there a risk of infection?
Those things are definitely risks. I would say if the number one thing to be concerned with is the pain. I had a patient,
Okay.
and this is probably 15 years ago now, and I don't remember why she wound up at the periodontist. I may have referred her. She became suicidal after the pain
Oh my
and was being
goodness.
ignored, and she was angry with me for a time. I guess maybe because she still is my patient, but I mean, she was very, very damaged by the procedure and the pain that
Mhm.
she experienced afterwards. But my 2 cents to your listeners would be, if you have an area of, okay, let me back up. When I see gum recession in a patient's mouth, it generally presents between the age of 25 and 35. That's about the time you're going to start seeing gum recession. And the main reason being your jaw finishes growing in your mid-20s as your teeth come to, as I like to jokingly call, their final resting position. Sometimes the position your tooth is in is not necessarily where the ideal bone and tissue support is. And so as it comes to that position, you see the gum recession result. Usually about the age of 35 to 40, based on my 25 years of monitoring patients, it stabilizes. It doesn't progress. It doesn't get any worse.
Oh, okay. So, right, this is super interesting. So the person who presents with gum recession might be sort of influenced into having this invasive, expensive, painful process by having the fear of God put into them. Oh, look how recessed your gums are now. Can you imagine how much worse it'll be when you're 85? And you're saying, well, no, it actually won't be substantially worse. It's going to be about the same as it is now. Yeah. Oh, boy. Right. Okay, so periodontists for placement of implants, yes. For the gum recession or the grafting for that, not so much.
Yes, I think there's definitely a time and a place for it. I think severe situations where there's no attached tissue, where the tooth is definitely at some risk, absolutely worth the procedure. But I think it is extremely overdone with a lack of benefit to the patient.
You might want to get a second opinion if that's being recommended.
Yes, maybe try to find a conservative dentist that will listen to your concerns, honor your request to monitor. Take 2 to 3 years to monitor. You don't see progression. And the other thing on the same topic, which it didn't come up, but we used to blame patients for brushing too hard as far as their gum recession.
Yeah. Dentist said that to me some time ago. Oh, your brushing technique must be off.
And so one of the things I always struggled with that is, generally speaking, if you see gum recession, you kind of see it isolated, like one tooth has it and the tooth next to it doesn't. Well, you're not in there just brushing that one tooth too hard, right? So I think gum recession is not, I don't think aggressive brushing is beneficial by any stretch, but I don't think it's our place to blame the patient for it. I think there's so many factors, and one factor I haven't touched on is, because I've been doing this for the time I have been, and I've seen many patients over that period of time, I get to see their children, and I see genetically similar recessive patterns. So there's another factor there.
Yeah, interesting. And is there any practice that could actually that people could use to stimulate the I don't know what the correct term is, but like regrowth of that recessed gum, or is it a matter of once it's gone, it's gone? Like I'm thinking, I know there's some interest in lasers, in ozone, in all manner of things. Is there anything that has potential?
I'm not familiar. I'm sure there is. It's my least favorite area of dentistry. So I can't say I've spent a lot of time researching the possibilities of a more natural way, but I will tell you that I have seen, and it blows my mind every time, because generally speaking, without intervention, I don't know how the tissue would grow back. Maybe lasers can do something, maybe ozone, maybe there is a place for that. But I have had more than a handful of cases where I had areas of recession that were under watch. I'm keeping my eye on them. And years later, the tissue has now covered over the area that was under watch, and it's not inflammation.
Absolutely fascinating. And
fascinating.
So you haven't isolated any particular things that the person did or stopped doing, or no?
No.
It sounds to me like there's just so many fruitful areas for research in dental.
Well, I'm not sure fruitful for who, but
who's going to fund this, right?
Exactly.
Because if there's no patentable product at the end of this, if there's no sort of high-tech machine that someone has a monopoly on the manufacture or the use of, like, who's going to stump up the money for this?
Well, it's like I wrote about this morning on my Substack, was about the use of coconut oil as an oral rinse, and it goes back through Indian holistic medicine as a practice. And there's research that supports that it does have some benefit, but they don't really understand why. And because nobody's going to study it. Who's going to put a large, well-funded study together on a product that, you can get at the baking aisle of your grocery store?
Yeah, interesting. And yeah, I mean, we touched on the oil pulling thing
Yes,
last
last
time,
time.
and so I meant to pull this up actually so we could discuss it, and then I got distracted. But I do recall reading a study where there was a placebo control, which was just vigorous swishing with water. So
Water.
I'll put that in the show notes, and then people can kind of read that and make of it what
Yeah.
they will. Okay. Um, Finally, there were a couple of mentions of a sinus lift. What
Hmm.
is that?
Yeah. So if you don't have enough room to place an implant in the maxillary arch because the sinus cavity, especially around the upper first molar and second premolar are the most common areas where the sinus cavity almost dips into the path of where the root system is positioned. And so to have adequate length for the implant to osseointegrate with the bone, they'll go in and they'll lift the sinus and then put bone and place the
So
implant.
that's a whole lot of grafting going on.
Oh
Whoa,
yeah, that's a
that
big
sounds
procedure.
intense. Yeah,
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 yeah.
okay.
And I don't think it's, at least not in my patient population, it's definitely been done, but it's not aggressively done. I think it's avoided if at all possible.
Yeah, I can kind of see why.
Yeah,
What could
the
possibly go wrong?
complication. Yeah, yeah.
Yeah, yeah, yeah. All right. Well, I think we've covered off on. I'm checking my list here. I think we've covered off on the at least the bulk of the questions that were asked. Are there any that you spotted that I've missed that you'd like
Well,
to respond to?
I didn't see this come up, but I have a strong opinion and I wanted to share it. It doesn't necessarily affect your readers directly because they're too old to be considered for the procedure, but the procedure of placing sealants, which is another sort of,
Oh, yes, you mentioned that in our first conversation. We never got
yeah,
back to it. So thank you.
yeah,
Excellent. Let's talk
yeah.
sealant.
So it is a huge money making part of the pediatric side of our field. And I do believe that sealants have a place in certain populations as a preventative measure. And what a sealant is, for those who may not know, but the best analogy I can come up with is like flowing a top coat of nail polish
Okay.
over the biting surface of the tooth. And the tooth has the ability that you can bond that material to the tooth surface. So in a perfect world, that seems like a very reasonable way of sort of sealing those grooves, preventing bacteria from getting into those grooves in the future. Where I see issues are we don't have a great system for replacement. So it's usually one and done. You have it placed, and unless it visibly pops out in a short period of time, the replacement is there's not a good method for that and an indication for replacement. So one of the things that you see happen as you chew on this top coat of nail polish over time, the bond, because there's not much holding it, a filling goes down into the tooth. It has this huge walls to bond to and protect that bond. But you're talking about a thin film flown over.
A film of what? What's it? What's the sealant made of?
Well, it's of an unfilled resin, so it's another plastic, if you will.
Oh, great.
So over time, some of the biggest cavities that I have removed on my teenagers have been under these sealants. So the sealant is still intact, or mostly intact, but there's been some type of microscopic breakdown that's allowing bacteria to get under that sealant. And unlike a tooth that was a virgin tooth that we have not touched in any way, if you had early decay, you find it and you get it small. But under a sealant, they usually proceed or progress in a way that you are taking care of a very large cavity that might have otherwise not have been there.
The dentist is going to miss it basically because
Correct.
it's underneath the sealant. Yeah, I see.
Yes. And then from a holistic side, I heard the argument that the anatomy of our teeth with those deep grooves hold beneficial bacteria for digestion. And so when you seal them off, you're minimizing the tooth surface as far as the breakdown of food, and then minimizing that bacterial contact for that, that pre-digestive process. That I haven't researched well. That was just something that I read, and I was like, oh, another reason for me not to like sealants. But I would say to
Yep.
your population that I think that based on that, if they're paying attention to you, they obviously care about their health, so that therefore they care about their children's health. So there's some level of diet monitoring and oral hygiene routine and some type of hopefully routine care by seeing a dentist that they trust and feel comfortable with. But an underserved population that doesn't have access to care, that doesn't have a good diet, those sealants in the early phases of life may help, get them down the road a bit until they have more ability to care for themselves.
Okay, so you're not totally against them, but you do think that they should be used very selectively, and I'm guessing
Yes.
for fairly finite periods of time, or like,
Okay.
But then you can't remove them, can you? Or can you?
Well, not without having to drill the tooth on some level, because the
Oh
way
my
it flows.
God! All right,
So,
yeah. Okay, so no, basically,
yeah.
or not without a fair amount of damage and extra expense, right? It strikes me too that really the answer to this issue of these deep grooves, these deep naturally occurring fissures in teeth, being a risk for bacteria to accumulate and bacteria to make the acid, which then causes tooth decay. The answer seems to be exactly what we were discussing the last time we spoke, which is chewing. Eating a lot of really fibrous food. And when you look at these, people in Africa or, the Pacific Islands that have these amazing teeth, they open up their mouths to smile, which they do a lot. And you see this astonishing row of just beautiful teeth, gorgeous teeth, all straight and strong, like this nice broad dental arch. And what are they eating? An absolute ton of fiber. They're chewing on fibrous plants, and that chewing activity stimulates all this saliva flow. So whatever you've got kind of, stuck down there in the crevices is getting flushed out by this astonishing amount of chewing and the saliva flow that comes from that. So back to back to eating proper food.
Exactly. It all comes back to that, even with the fluoride argument. I mean, the amount of money we're spending buying up this toxic waste to dump it in the water. What if we spent that on public health messages of eating healthy, and encouraging patients to do that? Imagine all the other conditions that we
Jessica,
have.
who would make money out of that?
Oh
dear, oh dear. Oh, sorry. That's actually just brought to mind. There was a question that I missed, which was, well, it wasn't so much a question. Someone commented about chewing xylitol-containing gum.
Yes, I plan to write about this.
Okay.
As far as it being, helping with patients who have dry mouth to stimulate salivary production. As well as the benefits of xylitol. So I'm very interested. I listened to a great podcast a while ago. Actually, it was Dr. Peter McCullough. He was interviewing a dentist from the UK, I believe, and a woman, and patients will love this. She was very anti-flossing. And I thought her position on flossing was curious. And I listened to her argument, and she basically said, if you're eating the right foods, you don't need to floss. You don't have that sticky plaque in there. And patients they're not dexterous enough to get in there without damaging their gum tissue or the attachment. Mm-hmm. So I thought her argument was sound. It's just that, very few people have a diet healthy enough to, avoid flossing.
The other issue, and it's a really major issue, is that these super fibrous plants that our ancestors ate, and we know that they ate super fibrous plants because of this because of the study of coprolites or paleo poop, fossilized feces, right? And so it's very evident that our ancient ancestors were eating an absolute bucket load of fiber. I've seen estimates of anywhere, from like 100 to 150 grams a day.
Wow.
That's a lot of fiber. Now, I know the recommendation for fiber in the US, I believe for men, it's, what is it, like 25? Is it 35 grams for men and 25 grams, something like that?
I was going to say 30, so you're close, because that was what's coming.
That. Yeah. So let's just say 30 for argument's sake. And so our ancestors were eating somewhere between, say, 3 and a bit times that and 5 times that. And and again, the amount of fiber that they add is clearly evident from the analysis of the contents of their fossilized poop. So lots and lots of fiber. Now, of course, plant breeding over millennia, I'm not talking about genetic modification, obviously, I'm just talking about regular garden variety plant breeding techniques, have successively bred down the fiber content of all our plants. And so even if you're eating a lot of fruits and vegetables, it's going to be very difficult for you to get just the sheer volume of fiber and the types of fiber, because the specific types of fiber that are the non-soluble, like the insoluble fibers, which is what you see, say, in the Pacific Islands, where sugarcane was introduced as a cash crop, and the local people were put to work on their sugarcane plantations, right? And so they'd actually chew on sugarcane. I'm in a cane growing area, by the way, just up the road from me, are some of the most productive cane fields ever. Yeah. And of course, these are all mechanically harvested, but in the Pacific Islands, where people were put to work for ridiculously low wages, basically slave labor, to hand harvest the sugarcane, they would actually chew on these like big fibrous stalks of sugarcane. I don't know if you've ever seen this stuff. But
I haven't. No.
It's incredible. It grows tall like a really super thick grass. And if you look at this and you ask yourself, how would I go with chewing on this? That's what they do. And they have these magnificent teeth. So they're munching sugarcane. But of course, it takes, I think it's like 9 feet of sugarcane to produce a teaspoon of sugar. It's either a teaspoon or a tablespoon. Anyway, it's one heck of a lot of sugarcane. So you could munch on this stuff all day. You're never going to get enough sugar to damage your teeth, because you just can't munch your way through it. But in the meantime, you'll be chomping on this incredibly tough fibrous plant. But who does that now, right?
Well, and who even has the time? I mean, this sounds goofy, but who has the time? Sometimes, do you have time to sit down and eat a good full salad for lunch? I don't have time to chew that properly.
Yeah. I've actually read studies where the daily chew time of various species, specifically primate species, was assessed and then compared to the average chew time of humans. Now, so non-human primates, like say gorillas and chimpanzees, spend, I think in the case of gorillas, it was something like 6 to 8 hours per day chewing. And your average human spends about a half an hour a day. Yeah.
How is gum chewing, as far as this? It's because it's not hard what you're chewing. I just wonder if there's any.
That's really interesting, isn't it? Because with actually chewing fibrous foods, you've got the mechanical scrubbing action of the insoluble fiber, and then you've got the enormous production of saliva that occurs as the result of that chewing action. And so you've got two protective mechanisms. Now, in the case of gum, you don't have the fibrous scrubbing action, but you have the saliva production. So, but I guess it's as good a compromise as you're going to get most people to make, because they're not going to wander around gnawing on sugarcane, in their day.
Not very acceptable behavior.
Where are you going to get stuff? I can get it. I can actually just walk up the road with a machete and bring home some sugarcane, but your average person doesn't have that availability. So, all right. So, bisvalatol chewing gum, you would say yes.
Supportive, yes. In fact, one thing I guess to say, but I don't think we touched on this, but I will advocate for the chewing of sugarless gum and xylitol being the choice, especially after consuming coffee. People, I don't know if we talked about this, but one of the higher rates of decay that I see in my adult patient population is due to the chronic consumption of coffee over long windows of time. Okay, so I guess
sipping the coffee.
Yeah, so sipping it in an insulated mug, because coffee is an acidic beverage, and the acid, if you're constantly bathing your teeth in acid, if you have this nice, mug that keeps your coffee hot, and you're drinking, say 12 ounces of coffee, but you're nursing it over a 4-hour window, You
Oh
essentially
boy.
have a four
Okay.
and a half hour window of an acid bath for the tooth
Yeah.
structure. And the mouth, under a natural circumstance, takes about 30 minutes to neutralize back to a stable pH.
Huh.
And they do, and the tendency is to want to brush your teeth right after you finished your coffee, because you
Mm.
want that coffee taste out of your mouth,
But
right?
the enamel is in a weakened state from the
That's
acid.
right. And then you're brushing
Oh.
that acid right into the tooth structure. So I
Mm.
recommend to my patients to
Mm.
chew some sugarless gum, because you
Yeah.
stimulate salivary production, which helps to then mitigate some of the pH issues faster than without chewing, because chewing helps to stimulate that production.
Yep.
And then I'm a big fan of tongue scraping after you've had coffee. Not not so much from the acid. I can't comment on that, but just from the stain producing power the tongue has to just hold all that stain,
All
on that
those
surface.
polyphenols.
Yes,
Yeah.
and then your tongue is just, pushing that around. So big
And
fan
and
of
and so you might want to take your coffee, macchiato style, like just one small shot.
yeah. Yeah.
That's
Well, I joke with patients, it's not the quantity of coffee that you consume, but the time over which you consume it. So
mm,
I'm fine if you want to have 3 cups in 30 minutes, have at it. But
mm,
having 1 cup over 4 hours is far more damaging.
not a good
And then
plan.
especially if you add sugar or cream to it. So
Yes, yes. I was thinking, beyond the acidic effects of the coffee, if you're doing the typical, but by the way, I mean, there's no offense to you, but Australians always laugh about how god awful American coffee is. Well, we can't understand it because you got this huge influx of Italian migrants, right? And so you'd think that American coffee would be good, but it, people from around the world who come and visit Australia say, "Man, your coffee's like really, really good." I'm, yeah, because we got a bunch of Italians and they started coffee shops.
well, I'm so curious about that, because I consider myself a coffee snob. Like, I will take my own coffee maker and my own coffee
Mm,
when we travel, like
mm.
even on airplanes, because I just have to have. Because I'm right. I mean, most American coffee just you might as well just drink water,
Oh,
right?
dishwater! It's so
Yeah, it's so
disgusting.
disgusting. So
Australian
now I'm
baristas are in demand all over the world. Apparently, it's not a topic I claim any expertise on. On this is just something I've heard because, yeah, apparently Australia's a bit of a hub for quality coffee. So there you go.
Well, I might just have to come to visit Australia to see if in fact this is true.
Well, I await your coffee notes on this. All right. I think we've covered all or at least most. Apologies to anyone who sent a question in and I didn't get to it. But if I didn't answer, or sorry, if Jessica hasn't answered your question, feel free to sort of go, you didn't answer my
Yeah,
question, and we'll see
yeah.
if we can maybe get you to do it in writing. I just wanted to express my gratitude from the bottom of my heart. You have been so unbelievably generous with your time. I've had some really positive comments from listeners just saying, wow, this was great. This is a marvelous conversation. People are so appreciative of you sharing your wisdom. Is there anything in our three conversations that we haven't talked about that you just want to kind of get a word into to say, pay attention to this?
Well, I feel like I feel like we've covered a lot, and I can't think of anything off the top of my head. And I'm trying to have I'm sort of tailoring my Substack to now be not so much about the COVID nonsense, but to be a source for people to come when they have a question, just an opinion. I obviously can't speak to everybody's situation, and they need to have a good provider that they trust. But sometimes it's just fun to bounce ideas or hear opinions
Yeah.
that
Yeah.
may differ from what you've heard.
Absolutely. Yes, I am very much in favor of people taking, and we talked about this last time, taking responsibility for their health. And that also
Absolutely.
means that even if you find a provider who you think is just the bee's knees, don't just delegate all of your decision making to that person. You
Right.
should still have someone that you bounce ideas off, or if a procedure has been recommended to you, my suggestion would be go and see if you can find reasons why not to do that procedure. Read
Hmm.
those reasons, discuss them with your provider. if your provider gets their little snout out of joint and says, "Why are you questioning me, you peasant?" It's time to find a new provider.
Absolutely. Yeah. And I think that's a really good way of trying to sift through who might be a good provider for you, is being able to ask those questions and then the response that you get from that individual. Because if you truly care about the person that you're offering this care to and they have reservations or concerns, listening to them is paramount to making that relationship and building that relationship of trust.
Yeah, this goes back to the whole question of informed consent that we discussed
Yes.
previously
Yeah.
too. Yeah. Okay. Great. So, your let's just have you sum up with what would be if you were able, with the knowledge that you have now. Okay, I'm going to frame it this way. With the knowledge that you have now, and I know that you're a mother, what would you recommend, kind of like from cradle to grave, in fact from preconception all the way through a child's life? Now, I know, of course, parents lose control of what their children's life choices are at a certain point. But if somehow you're able to direct the unfolding of a human life from, preconception all the way through their life to maximize their oral health, their airway function, their dental health, what would be Jessica's 10-point plan or whatever?
Yeah. So first, pregnancy, no fluoride, don't drink any fluoridated water, because I think they've been able to demonstrate that there's potential harm to the fetus, even from the mother's consumption. And even then, once you're breastfeeding, to avoid fluoridated water. The amount of fluoride that's in breast milk is extremely low. So the body has an amazing capacity to filter it.
That should tell you something.
Yes, exactly. And that was brought up in something that I read. And then as far as diet, trying to keep your children, and this is something you would promote as well, trying to keep your child away from the processed foods that are so harmful, keeping them on a diet that's, healthier and crunchier and definitely promotes chewing, staying away from the passies, anything that's going to cause some type of malformation in the airway. And this doesn't relate to dentistry, but staying away from the childhood vaccination schedule, because I believe that the way we over-vaccinate, at least in this country, has implications on the immune system that causes the adenoids and tonsils to be so enlarged, which then complicates the airway. So I see so many.
Oh my goodness! Yeah, got it.
So many mouth-breathing children, because when we look in their mouth doing their oral exam, they have kissing tonsils. Their tonsils are so big in the back, and they have the droopy eyes and their mouth breathing. And I'm just wondering if it's as much an issue, if it's more of an issue now than it was 40 years. I guess if I go back 50 years pre the 1986 Childhood Vaccination Act that changed the number of vaccines, at least that we see in our country, and I assume your country.
We're not far behind you. There's
Okay.
a few shots that you have on your schedule that we don't have, but where Australia is definitely in the top 5 in terms of number of not necessarily individual childhood vaccines administered, but number of antigens administered. We're definitely in the top 5. We could be in the top 3. Like there's more shots on the childhood schedule here than there are in the UK. I know that for certain. But we're just a few less than you have in the US. Yeah, it's pretty bad here.
Yeah. Well, I hope there's going to be some changes to that in the near future. And then as far as their development, if they're being monitored by a dentist, and you start to see some type of jaw misalignments or tooth malpositioning, to look into more of the myofunctional therapy or the different ways of intervening at a young age that do not involve putting braces on. Not that braces are necessarily bad, but they have a lot of costs associated with them. And then there's the care that the children don't have the capacity to do adequately. That becomes a compromise in the future for their dental health. So looking at these more natural ways of we had the mewing that we talked about last time, and then there's some other things that I've seen in this country that I just haven't researched enough to know, but I know that they have benefit to the shaping of the arch and allowing the teeth to come in straight. And if you've missed it, if your child's already 6 or 7 and you've missed that window and their teeth are a little crowded and the orthodontist is pushing a 2-phased orthodontic treatment, try to get a second opinion on the possibility, because that has become, I don't know if it's in your country, but extremely popular in this country to do a 2-phased orthodontic treatment, early interception with a late interception obviously there's more money to be made because you're doing it twice. But then the child has braces at a very young age when they don't even, I mean, now their oral hygiene routine is even poorer than it might be when they get a little bit older. So trying to avoid that, and just teaching them good habits, from diet to care, to try to stay away from us if possible. I don't mean stay away. I mean, obviously to be checked and be cared for, but to minimize.
Yes. And then, because on preventive care rather than waiting until the problem has occurred and then.
And then to kind of wrap it up, but when you get into beyond the braces phase, you have a proper aligned dentition, teeth are straight, and your bite is comfortable. Well, now the wisdom teeth are going to start developing, and to not rush into just having them taken out, investigate, the possibility of being able to maintain them, to, manage the shape of the arch.
Fantastic. Okay. That's great. Thank you so much for your time, for your generosity. If you didn't live quite so far away, I would love to have you as my dentist, but man, that's a hell of a long trip for dentist.
I'd say a hell of a long way to come for a good cup of coffee too.
Indeed.
And I don't trust those planes not falling out of the sky with all of our jabbed
jabbed pilots. I tell you what, it is a serious concern. It is a very serious concern. I have thought twice about ever getting on a commercial flight again, particularly now when the airlines are trying to scrimp and save money by not having two pilots in the cockpit. What the heck? So first of all, we make it compulsory for them to get all jabbed up, and then we have only one person capable of flying the plane who's in the cockpit.
I have not heard that. That's scary.
That's I don't think that has actually been brought in, but it's certainly, the idea is being
investigated
because of course the airline companies are losing money. All right, scary world. So if I ever want to come and visit you, I might have to, I don't know, like come by boat.
I'm gonna take a boat. I live near the coast.
Oh dear, it's like going back a century. All right. So again, thank you so much. I am going to recommend that all of my readers and listeners subscribe to your Substack, which is Unpacking Truth. So if you just go to Substack and search in the search bar, I think they'll find it under your name too, but just look for Unpacking Truth. It's great. And massive appreciation to you from the bottom of my heart, and let's stay in touch.
Thank you. And I want to say thank you to you. You are amazing. The research you put out, your listeners and readers are so fortunate to have found you.
Oh, thank you so much.
Thank you for the work you're doing.
Oh, and by the way, if you in your research on dentistry, if you come up with something where you're like, I want to get this out there, drop me a line. I'd love to have you back on again. All right. Thanks again.
Thanks, Robin.